In this lecture, we will discuss normal sinus rhythm and how it would appear on the EKG. Normal sinus rhythm is considered the default rhythm of the heart. Just as the name implies, sinus rhythm starts at the sinoatrial node, or SA node. You may also hear it referred to as the sinus node. The sinus node is a small structure located in the lateral part of the sulcus terminalis at the junction of the superior vena cava and the right atrium. It represents the start of the normal electrical conduction system of the heart. So if you look here, our sinus node is this portion here, okay? So that is our sinus node where our electrical conduction system starts, okay? And let's just review it. We have our internodal pathways that come through here, okay, to our AV node. This is the AV node. We have this that comes to the left side of the heart, which is called our Bachmann's bundle, depolarizes that left atrium. Here we have the His bundle that comes after that, or the common bundle of His. And then we have our right bundle branch, okay, that innervates the right ventricle. Then here's our left ventricle. We have the left bundle branch, okay, that splits off into two fascicles. We have a left anterior fascicle and a left posterior fascicle, okay, and those fascicles in the bundle branches on the right side then go into our ventricular Purkinje system and innervate the myocardial cells, and then we have depolarization spreading like that. So as long as you can recall this normal electrical conduction system in your mind, as well as where the leads are located, and we'll go over that, identifying sinus rhythm on the EKG shouldn't be too difficult. So how is normal sinus rhythm manifested on the EKG? Well, let's go through this chart that we have here, okay? And we're going to start with the regularity. So if you look here, we say that the regularity is regular, okay? And if you recall, a regular rhythm, it means that our intervals are constant throughout, okay? So if we were to look to the P to P intervals or the R to R, we'll use the R to R here. So here's one R wave and another R wave of our QRS complex. So that interval will be the same as the following R to R interval, okay? And if you were to measure these all out, all of these R to R intervals would be the same. And because of that, we call this a regular rhythm. Okay, now in terms of rate, the normal sinus rate is between 60 and 100 beats per minute in adults. Okay, now in children it's a little different and it's age dependent. I put these values here if you want, and if you deal with pediatric patients, these are some values you can be aware of. Okay, notice that the newborn 90 to 155. Okay, 1 to 12 months, 100 to 170 beats per minute is their average. Okay, so you can see that range higher than the adult level, okay? But eventually, once they get to around 16 years old, we get to that adult level there, okay? So those values are there to reference, but again, we'll focus on the adults because those are most of our patients, and we're looking between 60 and 100 beats per minute. So how do we find the rate? Well, again, we're dealing with a regular rhythm, so we already have our R to R intervals mapped out. Here's one R wave to the next. We want to count the number of thick lines between them. 1, 2, 3, 4, okay, between 4 and 5, okay? So what is our rate? We would do 300 over 4 is 75, or 300 over 5 is 60. So it's somewhere between there, between 60 and 75, which is within our normal range of 60 to 100 beats per minute, okay? So that's the normal sinus rate. In terms of the P wave, we want the P wave to be constant and have that same morphology throughout, okay? So this is one P wave, okay? This is another P wave, another P wave, and another P wave. So notice how they're the same morphology throughout, okay? We want this in the sinus rhythm. Another thing to note is the axis. So the electrical axis in the frontal plane is between 0 to positive 75 degrees, okay? And if you look here, here's 0 degrees. All right, this is positive 90 plus or minus 180 and negative 90. So if we put our positive 75, let's imagine it somewhere in this region. So this would be the normal P wave axis, okay? Going leftward, okay? So imagine this is the left side, this would be the right. So it's going leftward and inferiorly, okay? Going downward. So that's in the frontal plane. Another thing to note here is let's look at where our leads are going. So why is it going in that direction? Okay, first off, so let's just erase some of this here so we can see this. So we're saying that the P wave axis is going between 0 and positive 75. Okay, so here's our sinus node. Notice when we look at the P wave, remember, we're dealing with things above the ventricles, okay? We're looking at atrial depolarization, so our P waves is things below or up above here. Everything below there depolarization of the ventricles would be the QRS complex. So when we look at the P waves, here's our sinus node. It's firing and everything is going in this direction, okay? Everything is heading that way to our AV node, okay? So if you superimpose that, this thing on this 4-quadrant system on there, you would see that our P wave is heading in this direction, okay? So that's why it's going in that way. Because of that, when we look at the configuration, all leads that are heading in that direction will have upright P waves. Okay, so if we put our leads here, so the upright leads would be 1, 2, V4, V5, and V6. So here's lead 1. Okay, where's lead 2? Lead 2 sits right here at positive 60 degrees. Then we have the left precordial leads, V4, V5, and V6 in the horizontal plane. So notice that the vector is heading in that direction, and we have a depolarization wave heading that way, so we'll see upright P waves. So you can imagine that this lead here is one of our leads, so let's call it lead 2. Okay, now in terms of, we see an inverted P wave in AVR, and why is that? Well, lead AVR is over here, and notice that we're heading away from that lead, so we'll see a negative P wave in AVR. So this lead here that we have, this rhythm, would not be AVR. Instead, AVR would have the negative inverted P waves. Okay, now in terms of the right precordial leads, V1 and V2, we can see upright P waves, which would be these P waves. We can see inverted P waves, like in AVR, or we can see biphasic P waves, okay? And when we say biphasic P waves, we want to see normally positive and then negative, okay? So upright, positive, okay? Downright, negative. And we could see these in leads V1 or V2, all right? So why is that the case? Okay, let's just erase some of this here. Well, normally, what happens is the sinus node fires, okay, and we said it's going leftward and inferiorly, but also the first vector is heading anteriorly, okay? And if you remember, these are our anterior precordial leads, okay, sitting over the right ventricle. So imagine it heading towards this lead, V1. So we see that initial positive deflection going upwards, and then it has to depolarize the atria, the left atrium, so it will head backwards. Think of the left atrium sitting posteriorly, okay? If you get a 3D model of the heart, you'll be able to see that. So then it's going to head away from that, okay? So it's heading away from V1, and that's why we see this negative deflection, okay? So positive as it's going towards it, and then the latter portion as it depolarizes the left atrium. And that's why when we look for right atrial abnormalities, we're going to look at the initial portion of the P wave, okay, because that represents right atrial depolarization. And then for left atrial abnormalities, we look at that terminal portion of the P wave in those right precordial leads. Okay, we'll get into them more in future lectures. Now, in terms of lead 3 and AVL, these tend to be variable, okay, what the P waves will be, and that tends to be related to the respiratory cycles. Now, in terms of another thing in sinus rhythm, we want to see the P wave to QRS ratio. So what do we mean by that? Okay, so again, let's just erase some of this here, so we can see what we're talking about. So P wave to QRS ratio. This is a P wave, this is a QRS complex, this is our T wave. So we're not talking about the T waves here, you don't have to focus on that, but the P wave to QRS complex. We want to have one P wave for every QRS complex, okay? And that's a 1-to-1 ratio. One P wave, one QRS complex. One P wave, one QRS complex, okay? P wave to QRS. So you want to see that, and you want the P wave preceding the QRS complex. The PR interval, okay, the PR interval, if you map this out, imagine this is our complex, this is the P wave, QRS, and our T wave. When we talk about the PR interval, it's from this portion, the beginning of our P wave, up until the beginning of our QRS complex, okay? That's the PR interval. Normally, it should be between 120 and 200 milliseconds, which is 3 to 5 small boxes in adults, and that is what we see here, okay? So if you were to map this out from this portion to there, it will be constant throughout each complex here, and it will be between 3 and 5 of the small boxes. When we talk about the QRS interval, this is the width of the QRS complex, okay? And we're talking about intraventricular conduction, so things below here in the ventricles. And this should be normal, okay? And what we see here is it should be between 70 and 110 milliseconds, okay? That's about 2 to 3 of those small boxes. And we see that here, our QRS width. So in this case, we'd be looking at the width of our QRS complex, so this. All right, portion here, and notice that we have narrow QRS complexes, okay? So that's another thing we'll see. And then in terms of grouping, okay, we don't see any grouping because we just have each one occurring one on its own. Okay, so no grouping present, and there's no drop beats. Every P wave that goes through, okay, so every sinus node that fires and makes its way through gets through the ventricles. Okay, so no ventricle, no drop beats at all in this case here. Okay, so let's briefly review what we discussed before we end. Okay, so normal sinus rhythm is the default rhythm of the heart. Okay, so normally this is what you see. It's coming from the sinus node, the SA node, we said in this portion here, and it goes at a normal rate. We said the normal rate was between 60 and 100 beats per minute, and how that was age dependent based on the person's age. For adults, we said 60 to 100, so we'll focus on that. The intervals are constant, okay, so everything's constant, and they're within normal limits. When we talked about the PR interval, we said it was constant between 120 and 200 milliseconds, and the QRS interval between 70 and 110 milliseconds. Okay, so those are normal and constant. This actually may occur with a ventricular escape rhythm or AV dissociation, which we'll discuss in future lectures. But just something, when you come back and review everything, that's something you'll start to understand and why that's the case. The regularity, we said it's regular, right? The R to R intervals throughout each one were constant in the same. So regular rhythm, a rate between 60 and 100 beats per minute. The P wave morphology should be constant in the same as we saw throughout these. The P wave axis should be directed between 0 and 75 degrees. Okay, the configuration should be upright in those left lateral leads. Okay, 1, 2, V4 through V6, inverted in AVR as it heads away from those leads. And we said the right precordial leads could be upright, inverted, or biphasic. If it's biphasic, it'll be positive in the negative. Okay, that type of wave. All right, and then variable in lead 3 and AVL. Remember, we want to see a 1-to-1 ratio between the P waves to QRS complexes. Okay, 1 for 1 with the P waves preceding that QRS complex. In terms of grouping, we said there's no grouping and no drop beats. Every P wave, every impulse coming from the sinus node will make it through the AV node and depolarize the ventricles. Okay, so no drop beats. Well, that's the end of this lecture. We discussed normal sinus rhythm and how it would appear on the EKG. I hope you learned something.